Okay, hey guys, how are you? I'm Terry Campbell, one of the flight nurses at the University of Chicago. We're going to go over vaginal delivery. Couple things that I want to just talk about in the beginning. First of all, when EMS calls on the teleradio, figure out what your risks are for this patient precipitously delivering. If this patient is a multip, if she's had a history of fast labors, if her bag is broken, or if she's premature, those are going to all increase your risk that you guys are going to have to do this delivery. Remember, you don't have to wait for this patient to arrive before you can call Dr. Stork. If you have any indications the patient is pushing, the patient feels like they have to have a poop, aka the baby, then call Dr. Stork so they can come while EMS is still en route. Okay, so that's the first thing. Second thing is, I'm going to show you guys how to do these deliveries in lithotomy. That's just the traditional way that we teach how to do these deliveries. But realize, laboring women are going to come in whatever position is the most comfortable for them. So us forcing this woman to lay on her back may be very unnatural and may make her way more uncomfortable. If she's laying on her side, again, my model is going to be difficult, so I can't turn my model on her side, but a side lying position is fine. Women may be squatting, they may be on all fours. All of those help to open up the pelvic outlet and actually make the delivery go a whole lot easier. I know that you don't want this delivery, but it's gonna happen, so let's make it as easy for the mom and for the baby. And so, that's what we're gonna do. So let's get started. I would like to introduce Vagina Lokia. She is the star of the show. So starting out doing a vaginal delivery. So we want to protect the perineum, which is the area between the bottom of the vaginal opening and the rectum. So her perineum on this model is pretty small. Can hardly see it. The other thing that we're going to do is, obviously when we're delivering, we're not going to be doing it in my kitchen. That would be a good thing. I have to tell you, every time I come home, or my sons come home and they see this pelvic model on my kitchen counter, the first comment they have is, Mom, how many times do we have to tell you to stop keeping your vagina on the kitchen counter? So if you're going to be delivering anywhere outside of labor and delivery, make sure that you're on a cot or something in case the baby gets away from you. They're slippery and they're wet. We want to make sure that they're landing on a surface, right? So I'm going to put a towel underneath my pelvic model here, which is easier said than done in this model, because it's just going to help elevate it so I've got more room to do the maneuvers. Okay, so we're going to start out with the Vertex delivery. So the head's going to be coming out. Most of the time when the babies are delivered Vertex, they're mostly in an occiput anterior position. That means the face is looking down. So once you see this, duct tape is not going to work, so we know we're going to deliver. Bottom hand is going to be on the perineum to help protect the perineum. Top hand is up here, not stopping that baby's descent, but just kind of slowing it down. Okay, baby's going to keep coming down. Okay, keep coming, keep coming. All right, baby's head is delivered. So we no longer have to suction the nose and the mouth. We don't worry about that till after the baby comes out. I'm going to check around the neck for a nuchal cord. If I've got one, I'm going to show you another example. I'm just going to slip that over the baby's head. Now the baby's shoulders are too wide to fit out this way, so the baby is going to make an internal rotation like this. You can see how my hands are placed over the baby's ears and over the baby's shoulders. That way I can keep the baby's head in alignment with the neck. And the body. So I'm going to deliver the anterior shoulder first by gently pulling down, and then I'm going to lift up to deliver the posterior shoulder, but you have to be careful because this is where you're going to get an armful of baby. So posterior shoulder comes up and baby is going to be delivered. Push. Okay, this one's a little sticky, but that's how we can deliver. And may I please introduce you to Cletus, the fetus, the second star of the show. I have to tell you, this actor was born to do this role.